Hi, I'm Eva Hernandez, and I will be doing a prenatal health education skills video. Like I said, my name is Eva Hernandez. My badge is visible, and I'm in a nightingale attire uniform. I have my pants and my shoes, and I'm going to go over some education for my patient that was ordered by the doctor. Prior to going in, I'm going to go ahead and wash my hands, and I'm going to identify the patient with first and last name and the date of birth. Those are my two identifiers. I'm going to introduce myself to my patient, and I'm going to go ahead and give her privacy, close the door behind me as I walked in, and I'm going to begin. Good morning, Miss Smith. My name is Eva, and I'll be your nurse today. The doctor has ordered for me to come in and give you some education on a healthy pregnancy. It's my understanding that this is your first pregnancy, so congratulations. The pregnancy usually goes for 9 months, and it's divided in 3 trimesters: first trimester, second trimester, and third trimester. On your first trimester, you will be seeing the doctor every 4 weeks. Second trimester, you will see the doctor every 4 weeks also. And then on your last trimester, that's when you're about 40 weeks, up to 40 weeks, then you're going to be seeing the doctor on a weekly basis. On today's first appointment, we're going to go over when your last period was, to make sure, so we can give you an estimated date for delivery. We're going to go ahead and do a pap smear. We're going to do a pelvic exam, physical. We're going to do also take vitals. We're going to have you give us a urine sample. We're going to also test for any sexual transmitted diseases, like for HIV, syphilis. We're going to also test for hepatitis B, rubella. What else? And for every time you see the doctor, for each trimester, each visit, it's going to be the same routine, blood pressure, vital signs, do lab work, and then on certain trimesters and weeks, we will do some other like ultrasound, and it could be an abdomen ultrasound. We can or do a transvaginal by using a probe. Also a test for do the sugar, the glucose tests, tolerance tests, and this is to rule out any gestational diabetes. But let me begin. Okay, so we're gonna go over your medical history, OB history, surgical history, any medication history, any so we're going to go over all that. Like I said, we're going to determine when your last period was, that if you remember, so we can give you a estimate date of delivery. Okay, so the lab work that we would do would be, the blood work would be determine what blood type you are, if you're A or O, positive or negative. We would check also for if you're anemic, also the RH factor. Also, if you're negative, then we would, and that's usually determined like within your 28 weeks. So this would be a test that would be done on your second trimester. But if you're negative, then we would give you an injection that's called Rogam. The medication is called Rogam to prevent any abnormality. Antibodies, I mean, they may be that would prevent from forming, and then if you're Rh negative, then that would be okay, because then we are able to give you, if you're Rh positive, then we would be able to give you Rh negative blood and Rh positive. Another thing that we do is we would, like I said, do testings for STDs, which I went over already. We would also want you to eat a well-balanced diet, which would consist of like chicken, cooked chicken, or fish or eggs, but making sure that this fully cooked. For protein, we would have you increase your calories up to 300 while you're pregnant. Also, we would make sure that you consume your vegetables, your green leaf, like spinach, broccoli, your carbs, for instance, quinoa, brown rice, your fruits, your milk, and also consume water to keep hydrated, and also make sure you take your prenatal vitamins, your calcium for development, for bone development for the baby, and folic acid, and they recommend like 400 to 600 micrograms to prevent any any type of birth defects, and the iron to support the increase of blood volume. We would want also for you to so that would be the first trimester. Second trimester would be same thing. We would go over the vital signs, do your vital signs, repeat a CBC to check if you're anemic. We would also listen to the baby's heartbeat, and talk about baby movement, see the fundal height, if your baby's growing accordingly, check the urine again. Also, we would do an anatomy ultrasound, and this would be between 18 to 22 weeks, and this is when you could find out the gender of the baby. And also, we also can visualize to see if the babies are growing accordingly and the organs are, if the organs are also growing in their appropriate size. And also we would do a glucose tolerance test, and this is more to rule out gestational diabetes, because this can affect you and the baby, because the baby could be bigger than expected because of the glucose, because the gestational diabetes. And once you deliver, there's times that it does go away, but there's times that it doesn't, and you may become diabetic. In this second trimester, like I said before, it's like 14 to 20 weeks, and your appointments are every 4 weeks. Third trimester is 24 to 40 weeks, and these visits are weekly. And once again, we do the routine of checking the blood pressure, vital signs, fetal monitoring, determine the baby's position for a safe delivery. Then we test for the GBS, what's the group B strep. If positive, then an antibiotic would be given prior to delivering, prior to labor, to avoid transmitting any bacteria to the baby. The exercise, we recommend that you exercise 150 minutes a week. That's equals to about 30 minutes a day. And we would recommend to do low impact exercise like swimming, walking, yoga, prenatal yoga. This helps with the circulation, back pain, and just feeling good overall, and also helps with keeping a healthy weight. Exercise that we'd like you to avoid would be any sports type of contacts, exercise or sports. We would want to stay away from any heavy lifting, like going to the gym and lifting weights above 100. Also, we would want you to avoid any type of sport or exercise that may have a risk of you falling. Now, when it comes to weight gain or how much weight we recommend, the BMI, it really depends on your pregnancy weight. So for someone that is underweight of a BMI of 18.5, it's recommended that they gain about 28 to 40 pounds, and then with the BMI of normal weight of 18.5 to 24.9, it is recommended that you gain 35 to 40 pounds, and then 35 to 40 pounds, yes. And then if you're overweight with a BMI of 25 to 29.9, it's recommended you gain 15 to 25 pounds. And then if you're obese with a BMI of 30, they recommend for of a weight gain of 11 to 20 pounds, which is much less. Another thing would be the three common complaints during pregnancy would be short of breath, swelling, nausea and vomiting, and trouble sleeping and shortness of breath. For trouble sleeping, I would recommend that you prop yourself up with some pillows. And for the swelling, I would say of the lower extremities would be to elevate the legs, prop them up on pillows, and those would be the three warnings for that you should contact your healthcare provider immediately. Would be for swelling of your lower extremity, increased swelling of your lower extremities, because that could be a signs of preeclampsia, increase of blood pressure, vision changes, headaches, because that can also be part of the preeclampsia. So that's one. And then the second one would be leaking fluid that you're leaking. I mean, it could be amniotic fluid, it could be urine, but you just never know unless you go seek medical attention, and they will swab to see if it's amniotic fluid or urine. So you would go to the hospital for that if you don't know if it's urine, or you can distinguish if it's urine or amniotic fluid. The other one would be swelling of the legs, preeclampsia, early contractions. If you're, say, in your 32 weeks, 33 weeks, and you start contracting, then it's preterm labor. So you would go and seek medical attention for that also. At the end of the day, any abnormalities or anything that you feel different, you're not sure of, don't hesitate to go to the hospital. It's best to get sent back home saying that it's nothing, then something may happen at home, or maybe too late for any type of treatment for you and your baby. So, yes, I will. This is all the information that I have educating regarding your first pregnancy, and hopefully this information will help, because we're all about promoting a healthy pregnancy. So I will send you home with all these information, written handouts, so you can look at it at your leisure time, because I know this is a lot of information, very overwhelming. And if you have any concerns or any thoughts or something that you didn't understand, just don't hesitate to call or make an appointment, and I'll be more than happy to talk to you and regarding any concerns you may have. And then if I don't have the answer, then I would ask the doctor, and I would get you an answer. Okay? Well, thank you so much. It was my pleasure meeting you, and once again, congratulations, and I look forward to seeing you in the next couple months for these appointments that we spoke about. Thank you.